Hi, this is Chris, and this is my second video in my prostate cancer story. Today's video will focus on PSA testing. PSA is a prostate-specific antigen, and that is a specific protein that a physician can monitor to evaluate your risk for prostate cancer. Now, the first thing that I want you to know is that most physicians will not begin testing your PSA before the age of 50. Now, as a man who is 43 and was recently diagnosed with prostate cancer, I'm an advocate for men having the test before the age of 50. And most physicians will do that upon your request. And it's a simple blood test. So there's no reason not to know where your baseline PSA levels are today. Now, I didn't know to ask my physician to run a PSA test, and definitely no fault of hers. I was not symptomatic in any way. I had no sense of urgency to urinate. I had no discomfort. My prostate did not appear to be enlarged. So it wasn't something that she would have known to check for. In fact, my PSA test was done outside of the normal annual physical. It was actually part of a testosterone therapy consultation. I had gone in to talk to a physician about ways to increase testosterone levels, to improve performance as I was working out 4 to 5 days a week, just not seeing the results that I wanted. And the first thing that they do as part of that consultation is test your PSA. And the reason they do that is that elevating your testosterone level can actually fuel prostate cancer. So they want to make sure that you're not at risk. Now, for me, my PSA level came back as a 10, where most physicians want to see that at a 2 or below. So we knew that something was going on and that we needed to pursue further investigation before diagnosis. So I was lucky to find a urologist the next day who kind of calmed me down and said an elevated PSA does not mean prostate cancer. And I want to stress that as well. Having an elevated PSA level does not mean that you have prostate cancer. It does mean, however, that you should work with your physician to understand kind of why your PSA is at the level that it is. For me, there were a few things that we went through. First was risk factors. There were really no risk factors. The cancer history in my family is more lifestyle, things like lung cancer, skin cancer, no known prostate cancer. So that was definitely a good sign. The second thing is, again, I was not symptomatic, so there were no symptoms of prostate cancer. So the first thing the doctor wanted me to do was just breathe and calm down. We decided to wait 3 months and baseline my PSA. One of the reasons for that is that I had worked out the day before and gone to a CrossFit class, so I was lifting heavy weights. I had cycled for 45 minutes at lunch and had sexual intercourse the day before my test. All 3 of those things can naturally elevate your PSA level. So we made sure that none of those activities happened 4 days prior to my second test, which happened 3 months later. Unfortunately, that test came back as a 10 as well. So we moved on to an ultrasound to get a closer look at the prostate, which did not really uncover anything unusual. So as I was exiting, the doctor recommended that we run one more PSA test, and that test came back at a 13. So now at a 13, I decided to move forward with a biopsy. I actually canceled an MRI that was scheduled that Friday that would have given us just a little bit better imagery of the prostate. But I wanted some conclusive answers. And if you watched my first video, you know that that answer was that, in fact, I was diagnosed with prostate cancer. It was aggressive enough that we needed to pursue treatment. But had I not gone to that consultation for testosterone, I would not have known that my PSA was elevated. especially if I waited until the age of 50. Now, I truly believe that if I would have waited another 7 years, my diagnosis would be very different. It is likely that the cancer would have moved outside of the prostate, and that both treatment and recovery would have been much more challenging for me. So the point I want to stress to the men watching this video is know your PSA level, find a doctor you trust, make sure that you're comfortable with what your PSA level is, and that you're monitoring that on an annual basis. Now, if you have any questions for me about my particular journey or about things that I've learned along the way, feel free to leave any of your questions in the comment section below.